Good afternoon, everyone. It is now 2:05, and we are going to begin today's webinar. My name is Evelyn Mantilla, and on behalf of Access Health Connecticut, I will be your moderator today. And first, let me send out a special thank you to all of you for taking the time to participate in today's webinar, and also wish for everyone that in this difficult time that you and your loved ones are safe and doing well. And let me also do a little bit of housekeeping items to begin. First of all, to let you know, today's webinar is being recorded, and we ask you to please keep your audio muted for the duration of the webinar. Additionally, if you have any questions, we are going to be answering them at the end of the webinar, so feel free to type your question into the chat box. If you are experiencing any technical difficulties with your audio, you can call in from your phone number at the phone number that is listed on the screen right now. And lastly, the webinar link and presentation will be available online for future reference in our learn.accesshealthct.com/community website. Again, my name is Evelyn Mantilla, and I am happy to first introduce you. Let me go through who the presenters are going to be for today, and then I will call them in the right order. So our main presenter today will be Katie Hearn. Katie is a Training and Quality Assurance Manager. Additionally, for support, especially in our question and answer session, we will have Deborah Eastman, who is the broker, community partner, and call center manager, along with Gigi Garcia, who is a broker and CAC support supervisor. First, let me call on Deb. Deb, I believe you have some comments before we begin the actual webinar, so please go ahead. Welcome.
Yeah, thank you, Evelyn, and good afternoon, everybody. Thanks for joining us and for supporting Access Health throughout this difficult time. I did review some of the questions, the pre-questions that came in, and I just wanted to let everybody know that ask the questions about commission, that it's best that you contact the carrier. Access Health does not pay commissions, and it's definitely a question that you want to talk to the individual carrier about. I appreciate your interest in the questions, but I think it's best that they answer any questions that you do have. And again, thanks everybody for joining us this afternoon. And I'm going to turn it over to Katie.
Hi, Katie, welcome.
Thank you, Deb. Thank you, Evelyn. Good afternoon, everyone. So as some of you may already know, we have extended our new special enrollment period for residents of Connecticut who currently do not have coverage, for those who are currently uninsured. And so that started on March 19th, and it is running through April 17th now. That extension was announced at the end of last week. So what this means for Connecticut residents is that those who have regular special enrollment reasons, regular qualifying life events, they can enroll online or by phone for coverage effective May 1st. But it's probably best if residents with traditional qualifying life events, if they can, it's probably best for them to try to enroll online, just because our call center is experiencing very high volumes of calls right now. Having said that, though, uninsured residents who don't have a traditional qualifying life event and are interested in taking advantage of this new special enrollment period, they will have to go through our call center in order to get a May 1st effective date with a qualified health plan. So for those enrolling between April 3rd and April 17th, who do not have any of the traditional qualifying life events, those consumers will have to go through our call center. And if they otherwise qualify for a QHP, they can enroll in a QHP for a May 1st effective date through April 17th right now. As I mentioned, those with traditional special enrollment reasons, can enroll online at this time, but due to the 15-day rule, there may be some consumers enrolling April 16th or 17th who would be eligible in terms of the systems rules for a June 1st effective date. If a consumer would prefer to have a May 1st effective date in such a case, then they could call the call center and request a May 1st effective date. But the majority of consumers who have traditional qualifying life events would not need to call the call center to enroll at this time. Let's see if there's anything here that we didn't talk about. Oh yes, we have not extended the special enrollment to dental coverage. It does not apply to dental coverage. Sorry, I've got something blocking my screen here. Sorry about that. All enrollments under the new special enrollment must go through the call center. Again, this is for uninsured residents who do not have traditional qualifying life events. And as always, customers have to pay their first initial bill to make their QHP coverage active or effectuated. Next slide, please. Anyone with a qualifying life event can enroll through the 60-day special enrollment period, the traditional 60-day window. And again, they can enroll online or over the phone, but if they have the capacity to enroll online, it might be best because our call center is experiencing very heavy traffic right now. Qualifying life events like losing coverage through a job, moving to Connecticut, getting married, all of those can be achieved online through the consumer portal. Of course, if you need to see the full list of traditional qualifying life events, you can go to learn.accesshealthct.com/qualifying-life-event. Applicants will still be asked to provide proof of their QLE if they have a traditional SEP. So that is still in effect. If someone enrolls because they have a loss of MEC, for example, they will still be asked to provide documentation of for their prior coverage. In some cases, they will just have the usual 30 days to send in that SEP documentation. Some customers will have as many as 45 days to submit that documentation. Those who are getting some additional time to submit their special enrollment or qualifying life event documentation will be receiving a notice to that effect. But of course, we recommend that consumers get in their QLE verification as soon as possible. Okay, so for some consumers, it's the usual 30 days. For others, it is 45 days if they enrolled between 3/19 and 4/2. But again, better to get that in sooner rather than later. Customers have to pay their initial bill to make their QHP coverage active. So in order for coverage to be effectuated, please remind consumers to pay that first bill. And as far as the effective date rules go, newborn SEP rules have not changed. Newborns are effective as of their date of birth. Next slide, please. Okay, so Access Health will allow some customers more time to provide verification documents, as I said. And in addition to that, if we're talking about the 90-day VCL, such as proof of annual income or some immigration documentation, 90-day is currently suspended. So that means that eventually consumers will have to provide verification documents for the traditional 90-day VCL types. But right now, we have suspended 90-day VCL. Okay, it's a little confusing because we have some SEP VCL still in effect and 90-day on hold. Eventually, those who have 90-day verification items open, eventually they will be asked to provide documentation. So In all cases, if anyone has been asked to provide documentation, it's better to get it in. But we will be providing some relief to consumers who may not be able to send in that documentation so readily, as we have suspended 90-day VCL across the board. Okay. Next slide, please. Okay, so CMS has also provided some guidance for Husky programs, and there have been some changes there. These are important to note. Those enrolled in Husky A, B, which is CHIP, or D, have had their coverage extended. So instead of having their programs end at the end of March, as they were scheduled to do, they have had their coverage extended by 3 months, so that they now have an end date of June 30th. And the same is true for Husky A, B, and D consumers who had end dates of April 30th. They have been given an additional 3 months without interruption. So now their termination date is scheduled to be July 31st. And again, I said the 90-day reasonable opportunity period, or VCL period, has been temporarily suspended. It has been suspended both for Husky Programs, CHIP, and QHP. This last bullet just refers to, we've sort of relaxed the income VCL verification insofar as if there's a bit of more of a discrepancy between what the customer attests to on the application and what our electronic sources are able to verify. It's okay. We've relaxed that income verification a little bit. Having said that, eventually, if someone is asked to send in a VCL document for income, whether it's annual or monthly, they will need to submit income verification. Okay, next slide. For those of you who were on prior webinars, this slide is probably a review for the most part. Again, important to remind consumers to keep their income up to date, especially now with a lot of people filing for unemployment and so forth. It's really important that people have both their annual and monthly income up to date on the application so that they're not missing out on any eligibility. Also, please keep in mind that this SEP uninsured new special SEP extension, if you will, is not to be used to purchase secondary health plans. So if a consumer already has a qualified health plan, this isn't really a time to be buying additional insurance. As we said, this doesn't apply to our standalone dental plans at all. Just regular special enrollment reasons can be used for purchasing standalone dental plans. Even customers formally terminated for non-payment or for verification issues can enroll at this time. Excuse me. So that means that between now and April 17th, if someone had a plan this year and stopped making payments, if they wanted to re-enroll in a QHP again, they could. If they never sent in their verification documents earlier in the year, that's okay, and say their coverage terminated, they could come back on now through the special SEP. Our call center number is there. We do have licensed brokers at the call center to assist with plan selection. Brokers who work outside of the call center can also assist their clients. We would just ask that if you are speaking with someone at the call center, that you have them document that you would like to assist your client with plan selection so that they are not referred to an in-house broker. Consumers with traditional qualifying life events will be able to enroll in the usual way. And again, I just wanted to stress that if you can do the application online using one of the traditional QLE reasons, we encourage that because the call center is really experiencing a very high call volume now, and probably will be at least through April 17th, if not longer. It's important to remind customers to make sure to pay their initial premium to the carrier to activate insurance. As always, consumers will not be fully effectuated until they have paid their initial premium. Okay, next slide, please. Deb or Gigi, did you want to speak to this slide?
Sure, this is Deb. I'll just go through the broker general information is out on our website and learnaccesshealthct.com. Downloading images and information, it's available soon on the broker and community pages under updates. Again, a lot of the information for brokers and community partners are out on our website, accesshealthct.com. And then any new steps, we advise that you call the call center. Again, as Katie mentioned, there is a backlog of calls coming in. The wait time is longer than we would like. However, it's lots of calls in. Not only are they QHP people calling in, but also Medicaid or new eligible people that have lost jobs and income. So we have to be patient with that. And the next one is any other enrollments, QLEs or Medicaid. Can enroll online by phone or in person. And I believe I'm looking at the in-person. I'm not sure if that's something that's still, we can pick up on that after, because I'm not sure if those, I don't believe those community centers are still open, but someone might want to advise me or correct me on that one. So again, the same little memo down below, we're experiencing call high volume. I do anticipate this week being better as far as trying to get into the call center. We encountered some problems last week with getting all the agents home and some technical issues, but most of that's been ironed out. So hopefully things will be better this week and the coming weeks as well. And then just the chart of who's eligible for special enrollment and who's eligible for the SEP period. So I'm not going to go through all that, but again, any questions, also the broker mailbox, and that's AHCT broker support. We can help out on that as well. I don't know if Gigi or anybody from the Navigator sites wants to speak about the in-person piece of it. Okay, we'll move on.
Oh, Deb, this is Ellen, and
Yes.
I help with the navigators. And I would say that the navigator sites right now, people need to call first.
Okay.
And if you go to our website, we have their phone numbers there, and they can talk to the navigators and they can decide what their next step will be. But they're definitely available by phone to answer questions.
Great. Thanks, Ellen.
Thank you, Ellen. Terrific. Very well. That is the end of our presentation, and we are now happy to take your questions. We did receive a few questions ahead of time, and Deb, can I call on you one more time to give everyone the reminder about the question that should be directed to the providers?
Sure. If you have any commission questions or concerns, please call Anthem or Connecticut, and they should be able to address any questions that you have. And again, we thank you for supporting us through this tough time. And I know sometimes it's frustrating calling the call center because it is a longer wait time, but however, we're trying to do the best, and they are trying to do the best that we can as quickly as we can. So thanks again, everybody, for your patience.
Understood. Very well. We received a few questions ahead of time, and let me pose some of them. In order to streamline and be efficient as possible, will people be sent to the broker with a user ID and password reset?
Evelyn, this is Deb, and I'll answer that. It's the same process it's always been, and I have reminded again in the last couple of days that what needs to happen is when they're giving the information back to the broker, they need to have the user ID and password. I just want to make the brokers aware, and even the CACs, that the call center, for security reasons, generally does not set up accounts for consumers. They can direct them how to do it, and I know they do through chat usually. However, at this high volume of time, it's quicker if they just walk through it or advise them how to do it. But most importantly, they need to give the consumer the information, the user ID and password, so that they can work with the broker.
Very well, understood. Thank you so much, Deb. The next question that arrived before the webinar started today goes as follows. Is it possible for help desk to tell the client to notify the agent that they have no user ID according to customer service checking this in their system? This will take away a phone call to service by the broker and the client to check if they have one on file.
Evelyn, this is Deb, and I read through that question. I'm not in itself, so I was a little confused. I don't know if you want to if that question wants to come through the AHCT broker support mailbox, and I could better answer that, or maybe rephrase, because I'm not really sure what it was asking.
Okay, understood. Not a problem. So what we want to do is we want to encourage the person who asked this question, if they reach out to us through the broker support or the CAC support lines. And we will be happy to share that information as we usually do on the chat box. So let me move along with the next questions. And the next question we received says, how can you sign up a client without them first reaching out to you on the site? Is that a possibility? Let me know who may be able to answer that question, and I'll be happy to repeat it if necessary.
So I think that's answering the question.
I'm sorry, Deb, but I'm afraid that you broke up a little bit, so we did not catch what you just said. Would you mind repeating yourself?
Oh, sure. So I think the question is, can they go about doing the application without calling the call center? And you do need, if it's a special SEP and an override needs to be performed, the call needs to come through the call center, and then it can go back out to the broker. But it's, unless it's a loss of MEC or it's a regular SEP, or normal SEP, I guess is the term I want to use, then that can go through, either the consumer can do it online themselves, or the broker can work with the consumer. But if it's a special SEP, it needs to come through the call center first.
Okay, very good. The next question I have that we received ahead of time says, do you have to be a legal citizen to become insured? I'm assuming obviously through Access Health Connecticut.
This is Katie. So there's been no change to the sorts of immigration statuses that are recognized by Access Health for qualified health plans or for Husky or CHIP programs. There's been no change. No, you don't have to be a citizen necessarily, but you do have to have a qualifying immigration status.
Got it. Wonderful. Thank you, Katie. Really appreciate that. Let's move along with a couple more questions. The next one I have reads as follows. Is the system ready to grant APTCs, or do we still have to call the call center?
So as far as the system granting APTCs goes, that is functioning as it always does. The reason that we're recommending for the new uninsured SEP that many of those calls go through the call center, or sorry, many of those clients go through the call center, is that we will have to adjust the effective date. So it's not really the APTCs that are impacted, it's that there is a manual process that needs to occur to ensure the promised effective date.
Very good. Thank you. Thank you so much, Katie. Now, we have a couple of questions that have come through with the chat box. Bear with me. This next question is a little bit on the long side, so If I need to repeat any part of it, just let me know. So the question goes as follows. Why doesn't the call center automatically give a user ID and temporary password when a person calls in, instead of telling them to call one of the 3 brokers they give them? And as a way of explanation, the person says it's very confusing for clients and require more time on the broker and client's part, since the client has to call the call center back.
Evelyn, this is Deb.
Thank you.
And they are supposed to give the user ID and password. And I'll just make sure that they're doing it. Obviously, it sounds like some of them are, so it might be because of timing that they're trying to move the call along, but I'll just reiterate to the call center that they need to make sure of that.
Very good. Okay, great. Really appreciate that. The next question I have says, if someone has lost coverage for non-payment or for not providing documents, can the consumer apply online, or does the re-enrollment have to be processed via the phone?
Katie, I'll take it. So it's they lost their coverage, and depending on what effective date and the timing of when they're coming in.
Yes, if they lost the coverage for non-payment or for
Okay.
not providing documents.
And they wanted to come in for the special SEP, then they would need to call the call center.
Got it. They do. So
Yeah, that's right.
Yep.
Yeah.
Just trying to make it, as easy.
Great. Thank you, Deb.
Yep.
Thank you, Katie. I want to highlight the fact that even beyond today's webinar, our participants are encouraged to contact us through the correct email addresses. For broker support, the email address is ahctbrokersupport@ct.gov. And for CACs, you can contact us at the ird.outreach@ct.gov. And you can see those email addresses posted right now on the group chat if you need to write them down. So with that, let me give another moment for any other questions that may need to come in. I am going to review what we have so far. And if you have, so please, if you have any questions, post it on the chat box, and we will be happy to answer it as part of today's webinar. I'll give a moment for that. Okay, very well. It looks like we don't have any other questions. And so with that, I want to, first thank our presenters for providing the information, the important information that we were able to provide in today's webinar. And secondly, thank each one of our participants for the time that they took to be part of today's webinar, and for all the work that you are helping Access Health Connecticut do to be sure that all those who are uninsured, who should be able to get their coverage, can do so at this time. And lastly, I don't want to miss the opportunity to both thank you and wish you all the best. We hope that everyone is safe and healthy, along with your loved ones. And we do take a quick opportunity to do a shout out to the essential workers that are helping all of us get through this very difficult moment. And especially, of course, the health workers, but other essential workers as well, that are helping make sure that things run and that our families have their needs met. So with that, I will close today's webinar. I will need to take just one moment to make sure that the recording is completed and